Upper eyelid surgery is what we're going to talk about today. The main goal of upper eyelid surgery is to remove the heaviness from the eyelid area, which typically makes us look older or tired. In some older patients, it can also be a functional problem, not just cosmetic, where the skin is so heavy that it makes it a little difficult to look left and right. The surgery in the vast majority of cases, when done in isolation, is performed under local anaesthetic in an outpatient setting. This means that you come in, go home the same day. The only recommendation from our point of view is that you have someone to bring you and take you away, as driving would be potentially unsafe after surgery. After discussion, planning, photos and marking of the excess skin, local anaesthetic is injected. This is the only unpleasant part of the surgery, if I'm truly honest. The rest feels very much like a dental checkup or potentially a scale and polish, nothing significantly worse than that. I have done many hundreds of these surgeries and I can say hand on heart that that's the experience the vast majority of patients have. In terms of the surgery, the excess skin is removed and then the eyelid edges are stitched together with plastic stitch held in place with paper strips. The key consideration and the reason for this video is to explain the benefits, risks, limitations and complications of eyelid surgery. Everybody suffers from swelling and bruising, as well as a clearly obvious scar in the early phases. Please be aware that this is normal. We will give you something to help cool the area to minimize swelling and bruising, but be aware you will have black eyes for at least 5 to 7 days. And these black eyes will affect both the upper and lower eyelid. In terms of other things to bear in mind, the stitch will remain in place for 5 to 7 days, and as a result it will be difficult to hide unless you wear glasses with frames. Things to bear in mind in the medium term are that the scar will remain visible, especially in patients with fair skin, but not exclusively. As a result, you may need to wear something to hide the scar if you're concerned about people seeing it, or make arrangements for additional time off. There will be some variation in position of the scar. We plan the scar location extremely carefully, but swelling and subsequent eyebrow movement can alter the position of the scar. If this is the case, then please be patient. As the tissues soften and settle, the scar position will change, but if it continues to remain slightly out of place, then revision surgery is possible. Please be aware that revision surgery is not always a good idea. Just because we can change something doesn't necessarily mean it's a good idea to do so. A very good result is a very good result. Many times we have seen an attempt to turn a good result into an excellent result can create complications that ultimately lead us to regret our decision. If this is our advice, then of course it's not easy to take, but try and accept that much better is not always possible. If there is a little skin excess at 6 months or so, then yes, we can remove a little of this. In eyelid surgery, we always tend to err on the side of caution. We would very much prefer to remove a little too little skin during the surgery than a little too much. A little too much can result in difficulty in closing the eyes. This is actually quite common in the very early phases following surgery, and some eye drops at night will help improve any gritty feeling that you might experience. Otherwise, overall, upper eyelid surgery has a high rate of satisfaction, but be aware that the scar colour, shape and position is not guaranteed to be invisible, and symmetry is also not guaranteed. Almost nobody is symmetrical, especially in the eye area, and as a result, you are unlikely to be any more symmetrical following your surgery than you were beforehand. If you have any questions about eyelid surgery, then please email or contact via adam@adamgoodwinsurgery.com.